Good morning, everybody. Myself is Professor Dr. Rajendra Deshpande. We are in the Ayurved College, Nigdi, Pradhikaran 44. And today is a Monday, that is 11th of June 2018. With me are the PG students. The title of the topic today is Ayurvedic Management of Diabetes Mellitus. Ayurvedic Management of Diabetes Mellitus. And this may be the endocrinology part number 12, if I am correct. You just check it. I think it's endocrinology part number 12. Am I right? So this is the part 12. In the last session, we have discussed about the modern aspect, modern management, modern medicines of diabetes mellitus. Now, when we want to see some Ayurvedic management, it's not merely a translation of the things, but there is some special understanding of Ayurvedic pathophysiology, because Ayurveda has its own physiological aspect, Ayurveda has its own pathological aspect, and based on that Ayurvedic physiology and Ayurvedic pathology, the Ayurvedic medicines can be understood very nicely. If you just say that this is a hyperglycemia, then the polyuria, then the glycosuria, and this is a stimulator for the beta cells, this is a receptor stimulating medicine. This is the language of modern medicine. But when we start the Ayurvedic discussion, the listener also should be well versed that Ayurvedic medical aspect should be understood only and only if we support it with some basic Ayurvedic physiology and Ayurvedic pathological aspect. That is very important, because there is some misunderstanding about the integrating approach. Integrating doesn't mean that you should only replace the terms, but it should be the basic fundamental philosophy should be well understood, and then only the treatment can be successful. So still, although I will use further more language of Ayurveda, to begin with I will just recall your memory with the basic concepts that we have already seen that there are two types of the diabetes, that is type 1 and type 2. That is type 1 is juvenile type and it is a insulin dependent diabetes mellitus. Type 2 is non-insulin dependent diabetes mellitus. Then there is also gestational diabetes that is detected during the pregnancy. And there is a fourth category which can be included as a miscellaneous or other types of diabetes which are basically drug induced. Many times there is a drug induced diabetes, especially in the steroids. Steroids are the drugs, Visolon, Prednisolone. When the doctor is prescribing or the patient is self-medicating with the steroid. Steroids are very commonly used by the modern doctors as immunosuppressants. Whenever there is autoimmune disease, it is very well used. Then it is used for bronchial asthma, it is used for rheumatoid arthritis, it is used for nephrotic syndrome. So if these steroids are taken for 2, 5, 7, 10 years, gradually the patient can land into the complication of osteoporosis, hypertension, peptic ulcer and diabetes mellitus. So these are the complications of long-term steroid use, Visolon or the Prednisolone. One of the famous disease created by that use is a Cushing's syndrome. Cushing's syndrome is nothing but the excessive use of the corticosteroids or the excessive secretion of the corticosteroids in the body. Then if you use the beta blockers continuously, that can also give the complication like diabetes. Some infections can provoke diabetes like rubella. Some genetic syndromes are there where we can get the diabetes as one of the feature like Down's syndrome or the Turner syndrome. Very rare cases, but still we must aware that there also we can get the hyperglycemia or the glycosuria. Okay, so this is the fundamental. Then we also explained that investigations to confirm the diagnosis, basically not known diabetic, then fasting and post glucose. If known diabetic, then the fasting and postprandial. If not known diabetic and the values are borderline, then either you can do the GTT, glucose tolerance test, full, or modified glucose tolerance test, that is modified GTT. Then also we have to do the HB1AC, that is the glycosylated hemoglobin, to take the average of last 3-4 months. Then microalbuminuria is one of the indication of damage to the kidneys. So microalbuminuria every 6 months. Okay. Now coming to the Ayurvedic ground, Ayurveda has included that particular condition of diabetes mellitus with a similar or the parallel terms like Madhumeha or the Prameha. Basically, Prameha is a used term, is a very, very broad term. Because in Prameha, there are many urinary disorders are explained. Try to understand. Prameha is equal to diabetes mellitus. Prameha is a group of diseases. Try to understand. And one of my teacher always explains me, Vaidya Yagodoshi sir, that 20 are not the types of Prameha. This is incorrect statement. Why? He said because each condition is a separate condition. Each condition is a separate condition. Nila Meha and other types of the Mehas are, each Meha is different. So in spite of considering the type of one disease, it should be considered as a group of the diseases. Prameha is a group of diseases. This I understood very nicely. For example, if we go for Atisar, then Vataja, Pittaja, Kaphaja can be the types, because everywhere there is a loose motion. And in that respect, okay, we can say because common feature, most of the times there is a Prakarshena Mehati iti Prameha. That means in many types of the Prameha, not each and everything, but many types of the Prameha, there is a excessive urination or the polyuria. Either frequency is increased or the amount is increased. So in that concept, then you can consider the types. But if you really think of causes, if you really think of pathogenesis, if you really think of the symptoms, that is clinical features, and if you really think of management, I am talking about four things: causes, then pathogenesis, clinical features and management, then Vinshanti Meha, 20 types of Prameha are separate entity. That is better to understand. But in Granthas also further, not all the Pramehas are described in detail. Symptoms or the causes are not discussed in detail about Ikshu Meha or Lala Meha, etc. Only the focus is done on the Madhu Meha. Do you understand? And Madhu is a word like a sweet. So Meha is a urine. So sweet urine, a very, very parallel term like a diabetes mellitus. Mellitus means also sweet. Mellitus is also sweet. And it is also the polyuria. I have explained to you, diabetes insipidus. Insipidus is a word, Latin word, tasteless. Insipidus without taste. Mellitus, sweet taste. And that is very interesting. Madhumeha, sweet taste. Diabetes mellitus, sweet taste. And plus polyuria, increased frequency. Okay. So we will talk about this Prameha concept. Prameha is supposed to be Mahagada according to Ayurveda. Mahagada. Gada in Sanskrit means disease, and Maha means very dangerous, very difficult to cure, very problematic diseases, serious diseases, not serious in the sense fatal, but serious in the sense of complications, serious in the sense of difficult to cure, very troublesome to the human being. And which are those 8 diseases explained by Sushrut? We will make a list. Number 1, Vata Vyadhi. First Mahagada, Vata Vyadhi. All neurological problems related with the brain and nerves, all neurological conditions, they are very difficult. Nervous system problems are very difficult to cure. Second, Ashmari, calculus. Different types of Ashmaris, but basically Mutrashmari, renal calculus, kidney stone. Recurrence is very common. Always a fear whether it will recur or not. Third one, Kushta. Not only leprosy, Kushta means all skin diseases. And skin diseases are moreover times are having very difficult to cure because again they recur again and again. They recur again and again, and many times it is very difficult to control them, especially psoriasis, for example. Then Vicharchika. So all these are very difficult to cure. Then Mehodara, Meha and Udara. Third one is Meha, that is Prameha. I am sorry, fourth one. And Udara is the fifth one. Prameha, temporarily we will collaborate it with the Madhumeha or the diabetes mellitus. And fifth one is Udara, that is the accumulation of fluid in the peritoneal cavity, that is ascites, complication of cirrhosis many times. Udara is very difficult, is a Mahagada. Then Bhagandara, anal problems, anorectal problems, fistula in ano, very troublesome, very complicated. Long-term treatment is required, surgery is required. Bhagandar, fistula in ano. Seventh, Arsha. It's again a surgical problematic case. Different types of the piles or the hemorrhoids, they are again many times not curable by medicines. They have to do the surgery, and sometimes recurrence is also common. So Arsha is a Mahagada. Then Grahini, eighth one. Enteritis or the colitis, colonic problems, intestinal problems are very difficult to cure. Chronic indigestion takes place and lot of problems are there. Long-term treatment has to be taken. For enteritis, colitis, irritable bowel syndrome, all can be considered under the Grahani. So I again repeat the Ashtau Mahagada, 8 difficult diseases to cure. Number 1, Vata Vyadhi. Number 2, Ashmari. Number 3, Kushtha. Number 4, Meh. Number 5, Udara. Number 6, Bhagandara. Number 7, Arsha. And number 8, Grahani. I hope this is very clear. Now, when we talk about the Madhumeha or Prameha, henceforth many times I will use, in spite of Madhumeha, I will use the term Prameha, but it is related to the diabetes mellitus. Try to understand. It's a compromise, because every time the even people, common people, they understand Prameha is equal to diabetes. So I will use that term here also. Prameha is equal to diabetes. But these Prameha or the group of the diseases or Madhumeha, they are having the pathology originated or having the symptom complex in two groups. One is called as a Kaphaja Prameha and another is a Vataja Prameha. Although it is a maturity onset diabetes mellitus and 95% the people are categorized in the Vataja Prameha, Kaphaja Prameha, Santarpanajanya, due to the excessive accumulation, that is faulty, what you can say, the nutrition. It is a hypernutrition, rather I can say. It's not undernutrition. That is Kaphaja. Kapha is a bioenergy which is related with the stability, growth and nutrition. But when it is in excess, anabolic process is more, addition is more than subtraction, then that becomes the congestion in your body, saturation in your body of the different waste product. The important waste product described in Ayurveda is at a tissue level is a kled. Remember. So the Prameha is a disease of kled, excessive accumulation of kled. And what is kled? It is very difficult to explain, because whenever metabolism takes place, there is good product is coming up as well as waste product is coming up. So whenever at tissue level waste product is accumulated more in the blood, then it is called as a kled. They are maybe like a secretions. Wound secretions, they are like kled. But for example, if I have the excessive albumin in the blood, excessive urea in the blood, excessive sugar in the blood, I am saying excessive, not normal, then whatever excess, the few days back in audio I have said that excessive is like a toxin. So here that all excessive urea, excessive sugar, they are working like a kled, is a liquid type of the waste product which is expected to go out, but it is not going out. It is saturated more in the blood, more in the body, and that causes the problem of obstruction to the circulation. The circulations are again of various types: chemical circulation, hormonal circulation, neuromuscular circulation. Every circulation will be hampered because of the obstruction due to the kled. Kled is like also arm. So all these terms are very similar. Arm, vish, kled, they are obstructions in the micro and macro channels. So in Kaphaja Prameha, we are saying that this is a clay the predominant disease. I think this term is very clear. Now, Vataja Prameha, having the problem with Apatarpana Janya, that means undernourishment is there. Your body tissues are not well nourished, either because of the disease pathology or because of your own starving. In diabetes also, in your practice, you will get some patient, they are not obese, they are rather thin. And we are surprised why this thin person, low weight person has having the diabetes. We don't understand. What is the problem? But Ayurveda has explained that can be the Vataja type of Prameha. Vataja Prameha and Kaphaja Prameha. Of course, in Kaphaja Prameha, as I have told you, that it is obstructive pathology. In Ayurvedic language, it is called as a pathogenesis of the special type, that is Avarana. Avarana is like covering. Avarana, this term in Ayurveda, a very specific term. But covering means like again obstruction. Avarana is denoting the obstruction. Covering is the word for the obstruction, try to understand, for the natural flow. And Vataja is always related with the undernourishment, that is Dhatu Kshaya, debility of the different body tissues. That means if your blood sugar is not controlled, how we diagnose to begin with? If it is patient is coming to you with the weight loss, he has damaged his many tissues, muscles has been lost, fat has been lost, then that comes under the Vataja type of the pathogenesis. So whenever the patient comes to you, first thing you have to look for whether it is in the category of Kaphaja or whether the patient is in the category of Vataja. Even during the life process of diabetes, he is regularly coming to you for 5 years or 10 years. So sometimes he is under the cover of Kaphaja, sometimes Avastha. Ayurveda always believes on the Avastha or the stage of the disease. Ayurveda don't believe start one drug and give it for 10 years. No. It has to be changed frequently. And what is the basis of changing the drug? You have to check every time whether it is Kaphaja pathology, Avarana pathology, obstruction pathology, or Vataja, that is Dhatu Kshayajanya pathology. Next, we have talked about the dosha. Now about dusha. There are multiple dushas are involved. Many dushas are involved in Prameha or diabetes mellitus. For the listeners who are first time hearing this Ayurveda, what is meant by dusha? Dusha are nothing but the body elements, body tissues, which are attacked by the vitiated doshas. When Vata, Pitta, Kapha are disturbed, they attack on your rasa, they attack on your rakta, they attack on muscles, fat, bones, reproductive tissue, and immunity. So vitiated doshas, when they attack the different body elements, those body elements are called as dusha. As you see that in diabetes, blood sugar is not entering into the cell, and all the tissues are formed by the different cells. Osseous tissues as having own cells. Blood, they are having own cells. Muscles, they are having own cells. So all the tissues, all the cells, they are not getting proper sugar, proper nourishment. That's why I am saying there is an involvement of multiple dushas, not only one and two. Of course, the main dusha is a fat. Basically, fat is the culprit. But other factor, there may be damage of rasa, that's why the patient is tired. Because prinana function, instant energy, is a function of rasa dhatu. Instant energy is a function of rasa dhatu, and that is hampered. So the diabetic patients get the tiredness. Blood, for example, if the proper hemopoiesis doesn't take place, the diabetic patient can be anemic, because erythropoiesis is hampering. Again, when the energy is not coming from the fat, the proteins are taken up. So that is, he will lose the weight. You understand? So even these diabetic patients, they suffer from the impotency. What is impotency? It is related with the Shukra Dhatu, Majja Dhatu. And that's why there are many dushas. Many body tissues are damaged. And that's why there are lot of complications in Prameha. Why there are lot of complications of diabetes? Because according to Ayurveda, there is involvement of multiple dushads, multiple damaged tissues or the cells. I think this pathogenesis is also clear to you. Now, what are the important points we should note when we treat the diabetes? Number one, genetic predisposition. In Ayurveda, it is called as a bija dushti. Bija is the word for male gamete and female gamete. So, Ayurveda also believes that this is a hereditary disease. Ayurveda has specifically mentioned about bija dushti, and these patients are very difficult to cure. Very difficult to cure. Number two, dhatvagni imbalance. As the body tissues are not properly functioning, their digestive fire is not properly functioning. All the hormones can be categorized as a dhatvagni. So that is as insulin problem is there, this is the dhatvagni imbalance. Next is we have to find out what are the basic causes for the kapha prakopa or the vata prakopa. And that's why we have to see the food and the lifestyle. We have to find out which are the causes wrong in the food habits, which are the causes wrong in the lifestyle, ahar and vihar, dushti. We have to check out. Before treating the diabetes, we have to consider the bija dushti, that is the hereditary predisposition, dhatvagni, that is the insulin problem, ahar vihar dushti. And as I have said, that metabolism is disturbed, so clay the vruddhi is there. Clay the vruddhi. Clay is a subtle or the minute waste product. And lastly, we have to also consider or find out the complications in various srotas or various dushya. Where are the complications? Which srotas is damaged because of the uncontrolled diabetes? Which srotas is damaged? We have to find out. And now, how we'll go further? How we will manage? These are the basic points to consider before management. Now we have to plan for the management. How we are going to plan? For example, as a family physician, if we found that particular person has a family history or hereditary history from his mother, father, brother, sister, then what is our advice? He should be careful for his food and lifestyle from the very beginning. Whenever he comes to you, you are always a habit in a general practice. Okay, you are suffering from right now headache, from the migraine, from the asthma, from the acidity, from the constipation. But you take the history, present history, past history. So in that family history, so if in the family history you find that there is a bija dushti, you will warn him beforehand. So there will be preventive aspect based on his prakriti and dhatu sarata. This is the first step in the management. We have to find out his prakriti, and according to the prakriti, his lifestyle should be resetting according to the base of Ayurveda. Biotype, constitution, he should follow the prakriti advice. We have also the dhatu sarata parikshan. Ayurveda can examine each tissue of your body, which is called as dhatu sarata. And if we found that some tissue is weak, rasa, rakta, maus, med, asthi, majja, shukra, if any dhatu means tissue is weak, that is what we call as alpa sarata or hina sarata, madhyam sarata, then we must advise him to take rasayana to improve the immunity. This will be the preventive management of diabetes mellitus according to the Ayurveda, doing the prakriti and sara parikshan and correcting his bija dushti. Next step, Agni concept is very important in Ayurveda. Ayurveda says, rogaha sarve api mandegnau. Each and every disease is because of the problem in your digestion. Agni is a digestion power. Problem in the metabolic process. There are different types of Agnis, but mainly 13 Agnis are important. One is the Jatra Agni, 7 Dhatvagni, and 5 Panchabhautika Agni. So all these Agnis are basically starting from the Jatra Agni, your primary digestive fire from mouth to the small intestine, where primary digestion takes place. There is a saliva, there is a gastric juice, there is intestinal juice, there is a pancreatic juice. Different enzymes are working. To get a proper primary digestion, Ayurveda has given you different concepts like Ahar Vidhi Vidhan, Ashtau Ahar Vidhi Vishishayatana. These are the Sanskrit terms, but the simple way what food should be taken, when should be taken, and how should be taken. There are specific rules that you have to explain to the patient. Because we should not go directly replacement insulin therapy. That is what you can say the bandaging, temporary bandaging or curing. But we have to treat the root cause. We have to find out how is the lifestyle, what substances he is regularly eating, and what time he is eating, how he is eating, whether always he is in a hurry. Because if your primary digestion hampered, your tissue digestion will also hamper. Ayurveda says quality of Dhatvagni depends on quality of Jatragni. And that's why all these instructions are very important. Agni Deepana Chikitsa is very important in Prameha or diabetes. Agni Deepana. Next, I have mentioned that already in diabetes your digestion has been lost, hampered. And what is happening because of that? Ama is there, Kleda is there. So what is the next step in management? You have to do the Ama Pachana Chikitsa. Ama Pachana and Kleda Shoshana. Ama Pachana and Kleda Shoshana. These are the Ayurvedic words. And how you can do that? Or parallel, what you should do? Srota Shodhana Chikitsa. You have to cleaning the micro and macro channels. You have to clean it out. And after that, you have to also look for basic shamana of the predominant dosha. Whether it will be kapha or vata, you have to dosha shamana should be there. You should try to improve the Oja factor in the patient. Oja is nothing but the essence of all the 7 dhatus or the tissues. If the every metabolism of all the dhatus are good, your Oja or immunity will be best. But you have to take care that Ojaskara treatment should be there. Immunity building treatment should be there. What will be the benefit? It will prevent the further complication of the diabetes. That means dosha will not spread into the shakha. Ayurveda has explained this typical feature, Koshtagati and Shakhagati. When doshas are moving from shakha to koshta, that is physiological aspect. That means they should secrete in the viscera for proper action. But if they are staying away from the koshta and they are going into the deep tissues, that is called as a shakhagati. So you have to maintain that vitiated doshas should not spread into the different srotasas, so that complication will be prevented. Now, as I have mentioned few days back, for each disease there are the 6 steps that one should follow in the management. Any disease you have to treat, especially chronic disease. There are the 6 steps Professor Deshpande always mentions. Number 1, Sankhshepatah Kriya Yogo Nidana Parivarjanam. The first step in treating any disease, find out the causes, probable causes, and try to stop probable causes. Try to stop. If the patient has a habit of sedentary life, ask him to walk, ask him to do exercise. Then only your cause will be removed. If the patient is having the habit of eating all the time pizza and burger, he should stop it. It is high calorie food. It is a fast food. It will not be digested. Your Agni will. Then although you are giving any Trikatu, Sunta Maricha Pippali, if you are giving the Nagar Motha or the Musta, best Amapachak, it will be of no use if he continues to eat burger, pizza and vada pav. So heavy food stuff, high calorie diet, he should stop. He should stop. He should stop the sweet eating. He should stop the sugar eating because it is not digesting. Kledha is forming, ama is forming. So first step in the treating, remove the cause. Sankshepataha kriya yogo nidana parivarjana. Second, pathya and apathya. Do's and don'ts are very important. What to do and what not to do. And this is regarding food and lifestyle. Pathya apathya regarding food and lifestyle. Especially diabetes, it is very important that medicine is only one part. But basically threefold treatment is there. Together it will be effective. Diet plus exercise plus medicine. Any single will not helpful. There should be all the time, all the life, he should have the control on the diet, he should have the control on the exercise, and he should take the medicines. Then and then only his blood sugar will be under control. So, at this moment I have seen that second step, do's and don'ts. Third, if the disease is chronic or it is doshas are utklishta, that themselves try to come out of your body, or sometimes the chronicity is there, then you must go for panchakarma or shodhana chikitsa in Ayurveda. That is the third step in the management. Shodhana chikitsa is must. You cannot paint your house unless and until you clean your walls with the rough paper or the polished paper, that is called as the polished paper. We rub all the walls with the polished paper and then only we paint the houses. Here also Ayurveda believes that whenever you want to treat chronic cases, first you do either Vamana, Virechana, Basti, Rakta Mokshana or the Nasya or Parapanchakarma procedures like Shirodhara, Kayaseka, etc. etc. So Panchakarma is must. Of course we have to check whether it is indicated or non-indicated. For example, the pregnant lady, we don't do the Panchakarma. Then next is a Shamana Chikitsa, palliative treatment, internal medicine. That is the fourth one. Fourth one, after Shodhana, there is a Shamana. Fifth one, Tatra Dhanvantaryanam Adhikaraha. If the concerned case is not in our hand, for example, if there is a retinal detachment complication in diabetes mellitus, it is very seldom that we can treat with only Ayurvedic medicines. Of course, when there are retinopathy, I am going to discuss, but in the early stage, we can manage. But in the later stage, you have to refer it to the ophthalmologist. If there is a complication of gangrene in the foot, toes, great toe, if it is a gangrene, then medicine will not help. You have to refer to the surgeon. Ayurveda says, Ayurveda has quoted, Tatra Dhanvantaryanam Adhikaraha. Dhanvantari is a Sushrut, surgeon. Adhikara means his power. That means the ball is in his court. And the last step Ayurveda has explained to manage any disease is a Rasayana Chikitsa or Apunarabhava, to avoid the recurrence or intensity of the disease. That is Apunarabhava or the Rasayana Chikitsa. So these are the 6 steps. Every time I will repeat those because this is very important to treat any disease. Now, I go further for the Panchakarma in this particular Madhumeha or the Prameha. When we want to do the Panchakarma, always there should be Snehana and Svedana as a Purva Karma. Snehana and Svedana as a Purva Karma. Snehana is done with the Katutikta Rasatmaka herbs. The herbs having the bitter or the pungent taste or the dry property. Like Karanja Taila, Kananja is a herb. Nimba Taila, externally and internally it may be Dhanvantaram Ghrita. Snehana is done for the Pramehi patient for the diabetes with Karanja Taila, Nimba Taila or Dhanvantaram Ghrita internally. Then Svedana, it should not be hard. Svedana should not be harsh. Remember, because there is a Medo Dushti. And you remember the shlok in Medasarata, Sukumar Upacharatam Achashti. Although the fat is looking to be like a big in mass, but for the tolerance of any treatment, this is very delicate tissue. So for the fat, you have to, according to Ayurveda, Mrudu Svedana is expected. Soft type of the fermentation, like Ushnodaka Snana, bath with the warm water, and Anagni type of the Sved. Anagni, not Agni Sved, Anagni Sved, without directly using the fire. So you can use the water vapor, for example. Then, about the actual Panchakarma, Vaman is very helpful for the diabetes, especially in the pre-diabetic stage. Whenever there is a kapha predominance, blockage is there, insulin resistance is there. Why there is insulin resistance? That minute srotasas are blocked. Insulin cannot help to receptor to stimulate to go sugar inside. So there must be blockage. Blockage in the sukshma srotasa. So that can be cleaned away while using the Vamana. Vamana is a cleansing process especially indicated in the kapha predominant disease. And Prameha is one of the kapha predominant disease. It will definitely reduce the avarana or obstruction. Kapha and Medo avarana hara. Vamana is a kapha and Medo avarana hara. Kapha and Meda obstruction will be reduced. Now, basically Vaman should be given at least once in a year in a spring season, Vasantik Vamana, for every diabetic patient. But then after in a year, intermittently, you can give Virechana as well. Why the Virechana? We will see. Why the Virechana? Because according to Ayurveda, Virechana is primarily for Pitta and secondarily for Kapha. Virechana is also for Kapha, but primarily for the Pitta. As we have already seen, that this is also a problem of Dhatvagni, and Agni is always related with the Pitta. So when we want to homeostasis, to make the homeostasis in Agni concept, in metabolism concept, we can give the Virechana. It will make the Pitta and Rakta Shuddhi, purification of the Pitta and purification of blood. So periodical Virechana, maybe every after 6 months, in diabetes mellitus is helpful. Virechana is helpful for Vatanulomana. That is also one of the important concepts. Vatanulomana in different micro and macro channels. It is not only acting, try to understand, only on the colon. Virechana, Vamana, these processes are meant for whole body cleansing. Because there is always misunderstanding. People are thinking Vaman is coming up, so naturally it is helpful for only chest. Virechana is from downward, so they help that my stomach will be clean or my intestines are clean. It is not like that. Vaman and Virechana are cleaning for whole body. That is most important. So by giving Virechana, you are improving Vatanulomana, that means neuromuscular conduction, hormonal conduction, hormonal flow, then chemical conduction, everything will be improved. Try to understand, and from the whole body. So what we are talking about, pituitary, hypothalamus, this axis, pancreas, this axis will be also cleared up because of giving Virechana. So if the Vatanuloman takes place, it will prevent the micro and macro angiopathy. Micro and macro angiopathy, the problem or the complications regarding blood vessels. So Virechana can prevent heart attack in the diabetic patient. Virechana can prevent stroke or the hemiplegia in paralytic patients, in diabetic patients, because we have already seen that cardiovascular problems are there, then brain problems are there, so that can be prevented. Tingling numbness, peripheral neuropathy, that also can be prevented by doing this particular Virechana Chikitsa. Virechana can be given by many drugs. But if you want to use Anulomak just as a laxative every day or intermittently, then Abhayarishta is the best. Haritaki or the Hirada. Diabetic patient can be prescribed Gandharva Haritaki Churna, 2 or 3 grams at night with warm water. Now the tablets are also available of this Gandharva Haritaki Churna. So that can be used for the compliance of the patient. That is called as Erand Bhrishta Haritaki tablet. What is the name in the market? Erand Bhrishta Haritaki. Erand Bhrishta Haritaki tablet. Only one tablet. Even that can cause a little bit viration also. Remember, Erand Bhrishta Haritaki is little bit stronger than Gandharva Haritaki Churna. Abhayarishta is very soft. So you can prescribe also Abhayarishta. Now Basti, medicated enema, is more useful in the Vata predominant conditions. Vata predominant conditions. Especially when there is a diabetic neuropathy, then definitely Basti is advised. Diabetic neuropathy, Basti, medicated enema. Then Rakta Mokshan by leeches, Jalaukavacharan. Rakta Mokshan by leeches in peripheral vascular diseases due to diabetes mellitus. Peripheral vascular diseases due to diabetes mellitus, apply leeches. Especially in the diabetic foot, diabetic wound, you must apply the Jalauka or the leeches for better circulation and accelerated wound healing. Accelerated fast wound healing will take place if the leeches are applied near to the diabetic wound or diabetic foot or carbuncle or the abscess or the folliculitis. In all these conditions, you can apply the Jalauka or the leeches. Para Panchakarma procedures, not exactly included in the Panchakarma, but they are parallel to the Panchakarma. Udavartan is very helpful in the obese diabetic patient. Udavartana, dry powder massage with Rasnadi Churna or Triphala Churna. Rasnadi Churna or Triphala Churna, dry powder massage Udavartana in obese diabetic patient. Then there may be Takradhara, head shower on the head with buttermilk, Takradhara. That can also reduce the stress. Stress is one of the important factor for diabetes. Stress is one of the important factor. So in these patients, Takradhara or Tailadhara, both. Shirodhara is helpful in stressful diabetic patient. The cause is stress, then you must go for Shirodhara. Now I will talk about the Shamana Chikitsa or the palliative treatment or the internal medicines. What we can use. Internal medicines. There are different decoctions or the Kashaya. They can be used as per the dosha predominance. For example, Dhanvantaram Kashaya. Many of these are having the tablets as well. Dhanvantaram Kashaya for Vata predominant problems. Internally, always 4 spoonful of decoction plus 4 spoonful of water 3 or 2 times in a day. 3 or 2 times in a day. Dhanvantaram Kashaya for Vata problems in diabetes. Mahatiktakam Kashaya. Mahatiktakam Kashaya in Pitta dominant problems in diabetes. Pitta dominant problems in diabetes like peripheral vascular diseases, abscess, carbuncles, non-healing wound, Mahatiktakam Kashaya. Mahatiktakam Kashaya, Pitta dominance in diabetes. Guggulu Tiktakam Kashaya. Next name of the medicine, Guggulu Tiktakam Kashaya. Guggulu Tiktakam Kashaya, Vata Kapha problems in diabetes. Vata Kapha biotype, Vata Kapha person or Vata Kapha problems in diabetic patient. Guggulu Tiktakam Kashaya, Vata Kapha, VK. Next, Kataka Khadiradi Kashaya, Kataka Khadiradi Kashaya. Same, Vata Kapha problems in diabetes. Kataka Khadiradi Kashaya, Vata Kapha, VK problems in diabetes. Nisha Katakadi Kashaya. Nisha means turmeric. Halad. Nisha Katakadi Kashaya in Kapha-pitta Prakriti, diabetic patient, or Kapha-pitta problems, KP. Nisha Katakadi Kashaya, Kapha-pitta problems in diabetes. Nisha Katakadi Kashaya. Kashaya means decoction. Arak Vadhadi Kashaya. Arak Vadhadi Kashaya, Kapha-pitta problems in diabetes. Arak Vadhadi Kashaya, Kapha-pitta problems. Arak Vadhadi Kashaya, KP, Kapha-pitta problems in diabetes. After the decoctions, we will see some powders, herbal compound products, like a churna concept in Ayurveda, churna. Fine powders are there. Some important powders are Navayasa churna. Navayasa churna is a medohara. It will act on the fat metabolism, medohara. It will reduce the fat, Navayasa churna. But while reducing the fat, it will take care of the weakness. It will not affect the person any weak in his body while reducing the weight. That's why Navayasa churna is there. Then Triphala churna or the tablet, Kleda shoshana. Triphala is a Kleda shoshana because astringent in taste. Triphala churna. Then Amrutadi churna. Amruta is a guduchi or the gudvel. This is the best amapachana and the Vyadhi Pratyanik. Vyadhi Pratyanik specific for diabetes. Amrutadi churna in diabetes mellitus. Now, Aswas and Aristas, which can be used in diabetes mellitus, Lodhrasava, Lodhrasava, to reduce the Meda and Sveda Dushti, excessive sweating, excessive fat, that both the things can be controlled, Meda and Sveda, by using Lodhrasava. Then whenever there is a Prameha Pidaka, or again the blood problem, impurity of the blood, heating problem in the diabetic patients, non-healing wound is there, carbuncles are there, folliculitis, abscess, then Sarivadhyasava or Ushirasava. Sariva is Anantamul. Sarivadhyasava or Ushirasava for cleaning the blood, reducing the heat from the blood in diabetic mellitus patient. Then whenever there are neurological problems like tingling, numbness, hemiplegia in diabetes patient, Vata Vyadhi is there, arthritis in diabetic patients, Devadarvyarishta. Devadarvyarishta in diabetic patients for Vata Vyadhi. Devadarvyarishta in diabetes patient for Vata Vyadhi. Then there are some Rasakalpa, purified metals are used, Bhasmas are used in diabetes, and they are the important Bhasmas are Abhraka Bhasma, which act on molecular level, Vanga Bhasma, which is removing the kleda, it's controlled the kleda, Vanga. Also it is a Ojo Vardhak. Then if we mix Naga, Vanga and Jasada Bhasma together, that is called as a Trivanga Bhasma. When we make addition, Naga Bhasma plus Vanga Bhasma plus, then that formulation is called as a Trivanga Bhasma. Trivanga Bhasma is a specific medicine for diabetes mellitus. Then there is a Rasayana drug which is used for chronic diabetic patients to avoid the complication. Vasanta Kusumakara. Vasanta Kusumakara is a Rasayan or tonic for the diabetic patient to take care of weakness in spite of using the modern B complex tablets or the injections. You can use the Vasanta Kusumakara tablet from Ayurveda. Then Shila Jatu is one of the best medicine for diabetes. So Shila Jatvadi Vati is available. Shila Jatvadi Vati. Vati means tablet. That is also act on the fat and also the sugar. Then there are some medicated ghees. Try to understand, although we are using the ghee, it is not a plain ghee. So don't worry about the fat metabolism or cholesterol metabolism. As they are the medicated, so the total property of ghee is changed, and it is used to prevent the complications of diabetes mellitus, because in chronicity it damages many tissues of the body and there is a degeneration. To prevent that degeneration, Shamana Sneha are used in Ayurveda. Shamana Sneha. And which are those Shamana Sneha? First, Dhanvantaram Ghrita. Dhanvantaram Ghrita. Next is Guggulu Tiktakam Ghrita. Guggulu Tiktakam Ghrita. Third one, Kalyanaka Ghrita. Kalyanaka Ghrita. Fourth one, Trikantaka Ghrita. Trikantaka Ghrita. Now about the Shaman medicine, I will come to the last point of discussion, that is a tablet form, which is very easy to use by the patient. And that tablet form, one of the very popular, famous and experienced and well set drugs are Chandra Prabha tablet. This is one of the best medicine for diabetes mellitus or Prameha Vyadhi. Chandra Prabha tablet, which contains the Shila Jatu, main constituent. Then there is a Navayas Guggulu, second tablet, Navayas Guggulu. And last, third tablet, Shiva Gulika. Shiva Gulika. Shiva is for Shila Jatu. In Kerala it is called as a Shiva Gulika. In Kerala, South India, Gulika means tablet and Shiva means Shila Jatu. So it is nothing but the Shila Jatu Vati that we are using in Maharashtra. In Kerala it is used as a Shiva Gulika. Don't forget, Shiva Gulika. And the last point in our discussion, or my experience drug that I have personally made a research when I was working in Jnana Prabodhini, Pune. I have made a project with Diabetic Association of India, Pune branch. So it's authentic work. Diabetic Association of India, Pune branch. Dr. Ramesh Godbole, where I was working as an assistant doctor in his lab, he was a secretary at that time in that Diabetic Association of India, Pune branch. And then with Jnana Prabodhini and that two organizations, we conducted a research, clinical trials of Sharandhar pharmaceutical drug, that is DBT tablet. Capital D, these are alphabets, D, B, T, T for tree. So DBT tablet is available in the market of Sharandhar pharmaceutical. And we have given the patient tablet, 2 tablets 3 times in a day. Non-diabetic patient was there. And we conducted the trial, that means it is called as a crossover trials. That means the patient was observed. First we did the blood glucose level, then we continues whatever the medicines that he is taking, Dionyl, Glycinase, Glyciphase, whatever the medicines he is taking, we continued that medicine for 1 week. Again we took the blood sugar sample. Then we added DBT in that. If the patient is on plain insulin, lente insulin, mixed star, we continued that for 1 week. Then after that, we got the idea of how much is the range, how much it is controlled. And then in the second week, we started that DBT tablet and we continued for 1 month. And in between, we took the reading 2 times, every after week. And we found that the dose of allopathic medicines was definitely reduced. Dose of insulin was definitely reduced. And it was proved by objective parameter, not by subjective parameter. We tested the blood sugar and we were confirmed that DBT has definitely hypoglycemic effect. Why I am stressfully saying this point, my very, very kind request to all the listeners that please try DBT tablet but under the observation of any medical doctor. He may be the allopathic doctor, he may be the Ayurvedic doctor or the homeopathic doctor. Any patient, diabetic patient can consume this DBT tablet and I am sure his blood sugar level will be under control. But I am not suggesting or giving these things information for self-medication. So Dr. Deshpande is never for self-medication. So he says that this is my experienced and research proven drug. But it is on you to use this drug. But if the patient is hearing this my lecture, they should take this tablet under the supervision of any medical doctor. He should not consume the tablet by himself, but because there are chances of even hypoglycemic coma. I have seen that if I prescribe 3 tablets 4 times in a day, this DBT tablet, his blood sugar level immediately drops down. And that's why we have to control the allopathic drug. We have to reduce the dose of allopathic drug or insulin. And then we can combine this DBT tablet for controlling the diabetes mellitus. So I hope that diabetes mellitus, that DBT tablet contains 2 important ingredients. That also you must write down. Gudamara churna. Gudamar is one of the important plant. Sharandhar company, name of the company, and tablet is DBT, contains Gudamara churna and Jambu bija churna. Jambu bija churna. So these are the 2 important ingredients. Of course, there is little bit Shilajatu is there, little bit Jasada Bhasma is there, and overall effect is with that hypoglycemic effect. But DBT is one of my favorite and research proven drug for diabetes mellitus with objective parameter. Okay. So I wish you all the best because this is a nearly concluding point of our today's lecture of 11th June 2018. Today we discussed Ayurvedic management of diabetes mellitus. Ayurvedic management of diabetes mellitus, where I have given you the basic philosophy that Ayurveda says that prameha is included in Ashtau Mahagada. It is basically of 2 types, Kafaja prameha or the Vataja prameha. Then we have to consider the Bijadushti. We have to give the Agni Deepana Chikitsa, Amapachana Chikitsa, Kleda Shoshana Chikitsa, Srotas Shodhana Chikitsa. Then Dosha Shamana, and we have to Oja Vardhana Chikitsa, and we have to prevent the complication by Sthana Samshraya or the Koshtagati. Then we have to follow the Panchakarma, Snehana, Svedana, Vamana, Virechana, Basti, Jalauka, and other procedures. We have to give some decoctions like Kataka Khadiradi Kashaya, Nisha Katakadi Kashaya. We can use the different churnas, Asvarishtas, Rasakalpa like Vasanta Kusumakar, Shirajatwadi Vati, Trivanga Basma, and lastly I concluded with Chandra Prabha and tablet DBT. So I wish you all the best. I request to subscribe my YouTube channel for allopathic Ayurvedic discussions but in a very simple and lucid language. Thank you very much. Take care.